Hello everyone, welcome to my channel. Today we have another psychiatry question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 46-year-old man with a history of schizophrenia is seen in the outpatient psychiatry clinic 3 weeks after being discharged from the hospital for an acute psychotic episode. During his hospitalization, the dose of his antipsychotic medication was increased due to persistent persecutory delusions and command auditory hallucinations. Since returning home, he has remained free of hallucinations and reports that his thoughts are much clearer. His sister, however, has noticed that he moves more slowly than usual, rarely shows facial expressions, and no longer swings his arms while walking. The patient says he feels fine and denies depressed mood, suicidal thoughts, or hearing voices. On examination, he has a resting tremor, mild cogwheel rigidity of both upper extremities, and a slow shuffling gait. Which of the following is the most appropriate next step in pharmacologic management? First things first, we need to come up with a diagnosis. The patient is experiencing face like mask, cogwheel rigidity, slow shuffling gait, and tremors after taking an antipsychotic medication, and this is a prime example of antipsychotic induced Parkinsonism, and the medication we provide should help with that as well. With that being said, let's go over the answer choices. Continue the current antipsychotic and add sertraline. Well, sertraline is for depressive episodes and it helps with that. It's not going to help with the Parkinsonism that our patient is experiencing, and I can see how A could be helpful. B, switch the patient to haloperidol. Well, haloperidol is also a first generation antipsychotic medication, and there is no reason we need to change to a first generation antipsychotic medication because right now the medication that the patient is taking is helpful, and this first generation antipsychotic is not going to help with that. It's going to have the same problems. And B is not the best answer choice. C, continue the current antipsychotic and add benztropine. Well, this could actually be helpful because benztropine is an anticholinergic medication that helps with a lot of psychomotor uh, basically symptoms that come with antipsychotic medications. So I would say C could be a good answer choice. D, switch the patient to clozapine, and this actually is not helpful because uh, we reserve clozapine for very severe uh, cases of this illness, this psychotic illness, because it comes with risk of agranulocytosis. But if the patient is experiencing some psychomotor symptoms that cannot be reserved, which is the case with some of the antipsychotic medications, then we switch to clozapine. But right now, with shuffling gait and cogwheel rigidity and tremor, we are not going to change uh, to D. E. Continue the current antipsychotic and add propranolol. Well, propranolol also helps with some of the symptoms that come with antipsychotic medications, but those symptoms are related to the inability to stay seated, and it helps with restlessness, and this is not what our patient is experiencing. With that being said, the correct answer choice is C. Thank you very much for watching, and don't forget to like and subscribe.